Hello everyone. Today, we're delving into the world of a medication called Inflectra, which is a biosimilar to Infliximab. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Inflectra, Infliximab DYYB, is a biologic medication used to treat a variety of autoimmune diseases. As a biosimilar to the original drug Remicade, Infliximab, Inflectra has been approved by the FDA for several indications. It works by targeting and inhibiting a specific protein called tumor necrosis factor alpha, TNF-alpha, which plays a significant role in causing inflammation and damage in autoimmune diseases. Inflectra is primarily used to treat conditions such as rheumatoid arthritis, Crohn's disease, ulcerative colitis, ankylosing spondylitis, psoriatic arthritis, and plaque psoriasis. Warnings: Inflectra comes with its set of precautions. It should not be used in patients with moderate to severe heart failure unless a doctor deems it necessary, as it may exacerbate the condition. Patients should be screened for tuberculosis, TB, before starting treatment, as Inflectra can reactivate latent TB. Additionally, it is essential to monitor for signs of infections, as the medication can increase susceptibility to serious infections, including bacterial, viral, and fungal infections. Those with a history of chronic infections or recurrent infections should discuss these with their doctor before starting Inflectra. Before taking this medicine. Before starting Inflectra, it's crucial to inform your healthcare provider if you are allergic to Infliximab or any of its components. Patients with a history of heart problems, hepatitis B, or other infections should have a thorough discussion with their healthcare provider about the risks and benefits of Inflectra. Pregnant or breastfeeding women need to consult their healthcare provider to understand the potential risks and benefits. It's also important to inform your healthcare provider if you have any neurological disorders, liver disease, or a history of cancer. Side effects: like all medications, Inflectra can have side effects. Some common side effects include respiratory infections, headache, and abdominal pain. Patients may also experience infusion-related reactions, such as fever, chills, chest pain, or difficulty breathing during or after the infusion. Serious side effects can include infections, heart failure, liver problems, blood disorders, and an increased risk of certain cancers. It's essential to contact your doctor immediately if you experience any severe or unusual symptoms. Additionally, Inflectra can increase the risk of serious infections, including tuberculosis, bacterial sepsis, invasive fungal infections, and other opportunistic infections. Symptoms of serious infections can include fever, fatigue, cough, flu-like symptoms, and weight loss. If you develop any of these symptoms, seek medical attention promptly. Inflectra can also cause liver injury, which can present as jaundice, yellowing of the skin or eyes, dark urine, or severe fatigue. Interactions: Inflectra may interact with other medications, particularly those that affect the immune system. It's essential to inform your healthcare provider about all medications, supplements, and herbal products you are currently taking to avoid adverse interactions. Particular caution is needed when combining Inflectra with other biologic therapies or immunosuppressants. Dosage: the correct dosage of Inflectra is vital for its effectiveness and safety. Inflectra is administered via intravenous infusion, typically given in a healthcare setting by a professional. The initial dosage schedule for Inflectra involves an induction phase, followed by maintenance doses. For instance, in treating rheumatoid arthritis, the usual dose is 3 mg per kilogram given as an infusion at weeks 0, 2, and 6, followed by maintenance infusions every 8 weeks. The dosage may vary depending on the specific condition being treated, and your healthcare provider will determine the appropriate regimen for you. Avoid: while on Inflectra, it's advisable to avoid close contact with people who are sick or have infections, as the medication can lower your ability to fight infections. It's also recommended to avoid live vaccines during treatment and for some time after the last dose of Inflectra. FAQ: many wonder about the age restrictions for Inflectra. Inflectra has been approved for use in children for certain conditions, such as Crohn's disease and ulcerative colitis, typically in those who are 6 years and older. However, the safety and effectiveness in individuals younger than this age are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing: that wraps up our overview of Inflectra. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.